What's up, guys? Welcome to tonight's YouTube live stream. This is my first time I'm kind of streaming on my own, and there's been some hiccups. I apologize for that. And you guys can see me now. I'm trying to use this software, OBS live stream that everyone told me about, but it's not very intuitive. And I've used Zoom before, and it worked out. So see if more of you guys jump in. But I'm answering questions. If you guys want to throw down on the live chat, I'll be looking for those. And today, really addressing medical school, residency, and fellowship. Hey, Sophia, welcome to the live chat. Allison Orr, welcome to the live chat. Thanks for being here. Shout outs to both of you guys. And Evan Lewis, welcome to the live chat. Thanks for being here. So yeah, it's my first YouTube live, and happy to really answer questions about med school, residency, and actually pre-med too. I guess I'll start off with pre-med and go from there. And there's been a ton of new subscribers here on YouTube, and I really appreciate every single one of you. And thank you guys all for being here. Honestly, it's I don't know what happened in the last month, but it seems like you guys all like these reaction videos I'm doing with Grey's Anatomy, and I'll keep them up. And if you guys are learning something from them and you guys enjoy them, I will definitely I'll definitely be making more. There's more in the works. The next one, I listened to all your comments, so any episodes that you guys kind of request, I will make sure that we get up. And I'm setting up a system to try to get more of these out for you guys. It's tough because I'm practicing full time. I have a lot of duties at home, being a dad, and YouTube kind of slides to the back of my to-do list, unfortunately. But I'll try to get more of these videos out. Boo James, welcome to the live chat. Thanks for being here. Sophia Guzman asks, is it true that blood smells horrendous? I don't know if that's true. Honestly, blood, I don't really smell blood. I mean, I can see it in the OR, but I definitely can't smell it. I don't know if it's because you have a mask on, but there's no real smell of blood unless, in the OR, we try not to have a lot of bleeding, obviously, so I don't see that much blood. But what does kind of smell is when you use the electrocautery in the OR and you actually use it to burn tissue, to cut the tissue. And that actually, there's a smell to that smoke, and it's not a pleasant one when you first experience it in the OR. I remember being a medical student, smelling kind of that smell of burnt flesh and thinking that was a very gross smell. You get used to it, like everything else. When you are training as a student, as a resident, everything seems really new and insane when you first see it. But as you get exposed to it over and over and over, you just get used to it. So I don't really notice it so much anymore. Welcome to the live chat, guys. William Araniva, welcome to the live chat. Thanks for being here. Allison Orr says, I love your videos, especially reacting to Grey's. Thanks, Allison. I love these encouraging comments. Trust me, I read every single one of them, and I'm going to keep doing more of them as much as I can. Happy Father's Day. Yes, thank you. Father's Day was excellent. It was very fun for me. I think every year that I'm a dad, it becomes more meaningful, and it's a really great, being a dad is one of the greatest things I'm doing, I think. It's the hardest and most enjoyable and most rewarding, to be honest. So, all right, so we got some questions rolling in. You guys are here for the questions of pre-med, med school, and residency, and I'm probably going to try to get to as many of them as possible. So, Blue James asks, what advice would you give to pre-meds for balancing hard science classes with activities? So this is a good question. I think this is just all around asking, balance, right? So I think that there's a lot that goes into this, right? So you always question whether, am I working hard enough or am I balancing my schedule enough? And this is one key phrase I'm going to give you guys a nugget is that, and I used to think about this all the time when I was under time crunches in pre-med and med school, is that, you know, the only reason, let me see if I get this right. I haven't thought about it in a long time. It's the only reason you fail is poor time management. Right? That's a pretty good, powerful quote, I think. So the only reason why you fail is poor time management. So if you want to balance all these things, like your tough classes and pre-med is no joke. It's a tough experience. And you also want to do extracurriculars, you want to do research, and, you know, make sure your CV is, ready to go for med school. There's a lot you got to cram into your day every single day. And so if you have good time management, there's no reason why you can't accomplish all that. It's so funny. I remember in college, I actually pledged the fraternity, and it was actually a really rough time when I was pledging, and it was actually time consuming. And I remember taking a lot of time out for doing that, and it required all these extra activities and getting pulled to the side. But, and also I played water polo in college. And I remember during those times when it was tough, I would actually organize my time better. And I would be like, oh my gosh, if I don't organize my time, I'm not going to be able to do everything. And when I was more intentional about being really organized with my time, I actually accomplished a lot more, and I actually got the best grades then. So that's my advice. All right, we got to move faster with these questions. Sorry. So happy belated Father's Day. Thanks, Allison. Gamer says, hey. All right. Wow, we got 16 of you guys on this live stream. If you guys are wondering what music I'm playing in the background, this is K-pop. I play this sometimes in the OR. I'm not sure if you guys are fans of K-pop. You guys heard what happened with K-pop recently, right? They hijacked TikTok or whatever. The list I'm listening to here is K Club Party. It's on Spotify. I highly recommend it. It's a good one. K Club Party. All right, so. Hey, Dr. Dan, is it possible to become a team orthopedic physician without doing a sports fellowship? Yes, I do think so. I know that I don't really do this so much. I'm not really a team doctor anywhere, but I do know that some of I know someone who's a spine surgeon who covers team sports. Because orthopedic surgeons, even if you're doing spine or joints, you're still going through an entire residency where you learn about all those sports injuries. So I don't see why not. And you're a board certified orthopedic surgeon, so you should be able to do it. Allison Orr asks, sorry guys, Dr. Dan, I'm an aspiring orthopedic surgeon, possibly spine, trauma, or sports medicine. I'm a high school student. What do you recommend I do? Are there any opportunities as of right now? That's actually a really good question. So interestingly enough, I kind of knew that I wanted to be a doctor in high school. So I actually applied to a 7-year BA MD program, which is you don't have to take the MCATs in between. You just have to maintain a certain GPA, and you're kind of basically guaranteed into the medical school. And so they still have these programs. They have one here in Long Island at Hofstra University with the Zucker School of Medicine. They have one at Brown. They have one at Northwestern. That's the one I went to. So if you really know that you want to be a doctor, you got to go for these programs if you're pretty convinced. And they're pretty competitive to get into. So my advice would be to look into those programs. They're called combined baccalaureate doctorate programs, or BA MD programs. Hayden, hope that's helpful. Hayden King asks, hi, I just graduated from university with a BS in neuroscience, my fair share. Did you or any of your friends experience bad test anxiety in med school? So yes, test anxiety is a real thing. I definitely experienced it, and I remember the best way for me to fight it was to study as hard as I could beforehand. I'm gonna do a video eventually on how to ace every test that you take. So being on this route to becoming an orthopedic surgeon, you basically become like a professional studier. You become really good at studying. And I tell you that one of the things that you need to do is to practice everything that's going to be on the test multiple times. So what I mean by that? So if you know that your physics exam is on a certain topic, what I would do is go through that physics chapter and make sure that you do every practice problem in the back like 3 times. So people who do more practice problems are the ones who do better. And really what it is that the test should not be a time where you're sitting there figuring things out. That's what I would get anxious about if I felt like I was going into a test and I was like, oh my gosh, I kind of know this concept and I'm gonna have to figure it out tomorrow on the test. If I've already kind of practiced a concept over and over in my head, and then the actual day of the exam, it's not like you're actually figuring anything out. You already rehearsed it, so now you're performing. And it's almost like surgery, right? Because surgery, you're practicing it over and over and over in residency and fellowship, and then when you get to your actual patients, you just do it. Exams are like that too, if you really think about it. If you have practiced enough over and over and over, the day of the test should not be like you're figuring anything out. You've already done it multiple times, so it's a performance. So that's the way I would fight test anxiety. I think in med school there was just so much knowledge that you had to be responsible for every test that you never felt ready. So no matter what, there was some test anxiety, I think. And I remember studying really, really hard for my first exam in medical school, thinking, oh, I'm going to get 90th percentile like I usually do. And I got average. And I was super shocked and depressed about that. And then that did lead to some other test anxiety. But I think, the best advice I can give is, I think the more you prepare, you can decrease your anxiety. So, and then also good hygiene, like sleep hygiene, and making sure you sleep before your exams and you try to do something to relax the night before. Spend a couple hours doing something you enjoy instead of like cramming is probably good advice. I honestly, I was pretty bad at taking that kind of advice because I would cram right up until 1 a.m., 2 a.m., 3 a.m. and then just try to dump all my knowledge onto the test in med school. I don't recommend that. That kind of bit me in the butt as I moved on in medical school because that was not efficient a way of studying. Really getting a good night's sleep before was so much more important so that your brain could process the multi-step questions was really important. All right, let's keep going here. Dr. Dan I'm sorry guys, I'm probably really lagging on all these questions. Okay, actually there's not too many. So is orthosurgery residency really bad as they make it seem all 5 years, or is it really bad the first 3 years? It really depends. I think it depends on what program you go to, what environment you're working in. If you're going to some community hospital where you see just hip fractures and basic orthopedic trauma and you're not getting killed on call, then your residency might not be as painful. If you go to a level 1 trauma center where, I went to a level 1 trauma center and my 5 years were pretty challenging, I have to say. There was bad trauma that came in all the time. There were calls that I took in orthopedic trauma where I was in the trauma bay and it was me and the neurosurgery resident and the cardiology resident in the middle of the night. And we'd look at each other 2 a.m. and be pretty exhausted and be like, hey, this is what we signed up for. But it was because the place where we worked was a super busy hospital with lots of trauma. And so it depends on the hospital. I guess that's the best way to answer that. I think, and even when it's really bad, in my residency hospital, it was pretty tough. You still had a lot of good moments. There was a lot of fun and there was a lot of camaraderie with there's, I do these Grey's Anatomy reaction videos, and I know that people think Grey's Anatomy is so unrealistic. I think one realistic part is that the camaraderie, how the residents get along with each other and they support each other and they lean on each other, is super realistic. That actually happens for sure in residency, because residency is tough, and you really, if I didn't have my co-residents, it would have been a tough time. And they provided a lot of support. We provide a lot of support to each other. So, all right. how did you deal with failure in medical school? If indeed you incur failure in medical school, what strategy do you use to overcome such? So I did incur failure. Um, you know, my journey here, I know everyone, when they look at like an attending surgeon, and you see a surgeon in the clinic, you're like, oh, this guy must be so successful at everything he does. And yeah, there's a certain level of success you have to achieve to, hit all your milestones and move on. But there were lots of times in everyone's physician careers where we hit roadblocks and we didn't do so well on an exam, or we thought maybe we're not going to be able to match into a certain specialty that we wanted to. It definitely happens to every one of us. And I think that it's I don't know, that term grit, which is like resilience, right? If you get hit with failure, I know it sounds cliched, but it's not about it's about how many times you can get back up. And I know if you get beat down so much, it's like hard to get back up, but every failure is a chance for a new beginning or a new opportunity to improve or kind of rethink how you're approaching things. And sometimes when failure hits you, it just seems like the end of the world, right? It seems like there's no way out, or wow, I really need to quit. And I just think that, the doctors who make it, and everyone makes it who ends up in medical school, they just don't allow themselves to ever quit. You just move on. You look at what's in front of you and you move on. And that's actually important when it comes to doctoring and being a physician. When you have your patients and something is going on and you're struggling, patient's struggling and you're struggling, you can't get all depressed and bury your head in your hands and stop. It doesn't happen. In the medical shows, they don't do that. You move on. You sit down, reassess, and say, okay, what next step can I do next to handle the situation I'm in right now and fix it. So it feels cliche to say all that, but really I think fail and then reassess, let yourself fail, feel bad about it for a little bit, but always think to yourself, what can I do to recover and what am I going to do next to get to the goal that I need? So, all right, let's move on. This is my first YouTube live, guys. So thanks for all these great questions. I appreciate every single one of you guys. I've been doing Instagram lives, and but I like how YouTube, I'm going to do these lives and they're kind of going to live on forever. If I like the live, it's going to stay on here. Other people can enjoy it. All right, let's keep going here. And I like how you guys are asking questions that are totally on topic with the title of this live. I've noticed on YouTube, there's just such a great culture of encouragement and I don't know, rules. I feel I've had some weird comments on a COVID-19 video I did. So I know that there's people out there that are also not so nice. But it's a different world here than Twitter, per se. I'm on Twitter, and Twitter is this. Anyway, I'll keep answering these questions anyway. What inspired? Okay, so I hope I didn't. Okay, how do you handle the pressure that it's possible to take a life, or something that can change the patient's life? That's really a great question, Sophia. I think that people think surgeons are, oh my God, you're in control of someone's life. And you are, you're guarding someone's life. I like to think of it as you're guarding the patient's safety. Because when I'm doing a surgery, I'm not sitting here going, oh my gosh, if I feel like I'm going to do something wrong, or, this is so tricky or hard. You've practiced that surgery so many times that or you've done the surgery so many times that there's no doubt that the surgery is going to go fine. It's just that to make sure that the patient's safe and everything goes well and smoothly, I don't know, an airplane pilot or air traffic controller, you have to just make sure all the check boxes are checked off and everyone in the room is doing what they're supposed to be doing, and you're kind of the leader of that. And so I think it's more, just staying vigilant, staying concentrated, and making sure that everything you know to do, you continue to do during that surgery. So that's the best way I'm going to answer that question. All right. I prefer 1D. All right, let's see. All right. Let's see. Wow, we got lots of questions here. What inspired you to become an orthopedic surgeon? I could tell you my second year of medical school, I was trying to shadow a bunch of doctors. I shadowed like an endocrinologist. I shadowed a GI doctor. I shadowed all these different specialties. And I think when I scrubbed into a joint replacement surgery and I saw that the knee get cut open, all the synovial fluid, gushed out, and I saw the actual arthritis before my face. I was like, this is really cool. I'm actually staring at an arthritic knee and touching it, and just the anatomy right in my face was incredible. And I was sold. I was like, I have to do orthopedics. So that's what inspired me. How do you handle a patient's death? It seems so difficult. I don't know how I would cope with it. To be honest, I don't deal with death that much as an orthopedic surgeon. The patients I see are pretty healthy. They don't usually suffer complications that result in them dying. So Grey's Anatomy is different. Like everyone that comes in is like near death, right? And I keep talking about Grey's Anatomy because I'm making YouTube videos about Grey's Anatomy, but on that show, the surgeons are like trauma surgeons, a lot of them, right? They're general surgeons, and they deal with death a lot more. So my wife is actually an oncologist, and she deals with death a lot more. And I always ask her that question. I was like, how do you deal with it? It seems really depressing, really hard on you to, know your patients and then they pass away. But, I guess the flip side we always say is that if she wasn't there for that patient's family, how would they have been, right? They would have been a lot worse off. So, you look at the positives and you focus on the positives of how you're adding value and you're adding, humanity to that patient's care. And I think that's what allows you to get through it. Is there an age you'd consider too late to begin school and start a pathway to an MD? So I don't think so. Dr. Mike actually did a really great video on this with his friend or senior resident, Luis Espinoza, who I actually knew when I was a resident, small world. But he did an excellent video on this where they talked about he was a atypical applicant. He did residency a lot later or older. He was a lot older. So I don't think there's any age that is too late. I had like mid 40s student classmate I think he was almost 50, and he was a classmate of mine in medical school, and he did just fine. Look, I think that ultimately you're going to come to medical school at that point because you tried everything else, or you had another career and you just didn't find it fulfilling, and you want to do something with your life that you've always wanted to do, and you don't want to have regrets. And I think I respect that 1,000%. I don't think it's late. I think if you want to pursue that and your family is amenable to it, you got to go for it. As a surgeon, wow, I got lots of questions. You guys like this Korean K-pop? Sounds like I'm gonna change it here. All right. How do you, as a surgeon, do you find it difficult to have a good work-life balance? It can be. It depends on your setup for the practice. We take a lot of call. It makes your life harder. I think in terms of work-life balance, I do a lot of elective surgeries, so I know what time my schedule. I know what days, and what time my schedule my surgeries are, and I don't take call like every single day. So what does that mean being on call? It means you can get paged to the hospital anytime you have to pick up and drop everything you're doing and go to the hospital because there's an emergency. And that's what kind of alters your lifestyle as a surgeon. So if you don't do much of that, then you might have better work-life balance. So I try, I take call, but I don't take a lot of it. So I think my work-life balance is pretty good. That's why I'm on YouTube talking to you guys, because I have time to do this, right? Do you know about any program in Mexico? I'm sorry, I'm not familiar with Mexico and programs there, but I know you can probably connect with orthopedic surgeons in Mexico through Instagram or other social media platforms. Allison, thanks for the tip. I have posted some stuff on IGTV. I don't know about how I feel about IGTV. I posted some stuff on there. Instagram in general, I've been posting less on these days. I've been focusing more on YouTube. I love this platform. All right. Let's see. I am Asian and an aspiring surgeon. I want to practice surgery in America. A lot of my friends have warned me about racism in the States is a real problem. Did you face any? Look, you know, obviously there's been a lot of discussion about race in America, and racism is a problem here in America. Have I personally dealt with it a lot? No, I have not. I've been lucky. I feel like the programs I've been to, my medical school classes, everywhere I've been to, and being an Asian American, I don't think you're subjected to the type of racism that, you know, maybe African Americans are definitely facing in this country. So, so you know, there is some racism, but I don't think I've overtly faced it to the point where I'm a bit scared as a Asian American. You know, if anything, you know, maybe the model minority stereotype here that, you know, all Asians are model minorities helps us. But to the most part, to answer your question, I don't think it's a real problem. For me, it has not been. So, all right. What do you think about studying business as a pre-med? I think it's a great option. I don't think you have to have some type of science background to do pre-med. You can just, you know, study whatever you're passionate about, and it'll come out when you try to, when you interview. You want to talk about why, you know, you should have a reason for why you're studying it, right? So do you want to apply it, you know, when you get to being a practicing doctor and you want to think about the business aspects of medicine, you know, whatnot. So I think that you should have a reason for why you selected that major, but I don't think you should restrict yourself just to the sciences. What specialty would I be doing if I didn't do orthopedic surgery? I think I would have probably done anesthesiology. You know, I know that I should say like, I would be surgeon, I would be general surgeon. I don't know. There was something about general surgery for me that personally I didn't like. You know, I didn't enjoy my general surgery rotations. And I don't know if it was just because there was a lot of camera surgery, or potentially, I don't know if the senior residents were mean to me, but I didn't really jump on board with general surgery. So I think I would have probably done anesthesia, or maybe emergency medicine. All right, let's keep going here. Hey, Dr. Dan, what advice do you have for current med school applicants about to interview at med schools? So, so when you're interviewing, I think that one piece of advice I could give you is that whenever I had an interview process, I actually practiced, kind of like I told you guys about practicing for doing practice questions for exams. So like, I guess I'm trying to say like the key to success in anything is practice, 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 right? So even for interviews, you can write a list of potential questions you're going to be asked. And I'm sure if you go to some of these Reddit forums or somewhere, wherever you pre-meds are kind of gathering right now, you can crowdsource a bunch of potential questions for med school, or, you know, they do these like scenarios, right? Those MMI scenarios. I don't even know the names of those things yet right now, but they do these clinical scenarios, and you can maybe devise some or do some practice scenarios and actually have a friend interview you and videotape yourself. I know this is kind of intense, but I used to do this. I did this for residency interviews. I videotaped myself answering questions, and I like watched myself, and I was like, ooh, that's kind of cringy. That answer didn't come out right, you know? So, and then you don't want to sound too rehearsed when you actually answer those questions. But I think having these answer deposits in your head allows you to be a little more confident when you're on the trail and they ask you a question, they throw a question at you, and you're like, okay, I know how I feel about this question. And you can just worry about delivery and, you know, eye contact, you know, and, you know, getting your point across. And even then you just, you know, when you know deep down what you want to say and you just say it, it's not going to be robotic. It's not going to come out robotic. So rehearsal of the questions and preparation. Crystal Simmons says, how do you remember everything? Honestly, it's repetition, practice, repetition, practice. That's how I remember things. You know, even before YouTube videos, I actually look everything up, and like, I actually like rehearse it a little bit before I actually, boom, give you guys the YouTube video. I know it's like a secret, right? You guys are like, stop watching my videos. But for me to make sure I deliver it to you guys in a very efficient manner, so that you guys benefit from my 30 seconds of attention you give me, I want to make sure I do it well. So I think, how do you remember? How do you do things well? How do you say things well? It's all about practice, practice, practice. How much information are doctors required to know post-medical? Are these information from medical school? Yeah, there's a lot of stuff I don't remember from medical school, to be honest. There's so much stuff you're listening to in medical school that you just don't use. If you don't use it, you lose it, right? They say. So if you don't use it, you lose it. So there's a lot of information. I'm focused on orthopedics, like spine, which is a very narrow part of what you learn in medical school. So I have to look a lot of things up all the time. If it's outside the scope of what I'm practicing, I'm an expert when it comes to orthopedic spine surgery. I know everything about it, backwards, inside, forwards, backwards. I can tell you, exactly how to read an MRI, whatever. But when it comes to like a pneumothorax, which they talk about in a lot of these Grey's Anatomy videos, I have to like look it up and be like, okay, wait, I know what this is, but where did they put that chest tube and how did they do it again? And when I look it up again, I'm like, oh yeah, I remember learning about that. So a lot of stuff, if you don't use it every day, you're gonna forget. So let's move on. A nurse yelled at me yesterday. I cried. I don't think I'm cut out for this. I'm sorry. Typical Edith. I'm sorry that a nurse yelled at you. That's unfortunate. There's a lot of that in the medical profession, unfortunately. People yelling and screaming and thinking that they're allowed to do that. And I've lost maybe my cool in the OR a few times and things didn't work out. Like, someone messed something up, but unfortunately, people try to keep that to a minimum, and that shouldn't happen. So I'm sorry you experienced that. All right. How would I? And I'm gonna try to avoid like too many medical questions, guys. I don't like to give out medical advice on these live streams, and it's not the purpose of these live streams. So I get it. Someone's asking me the views of something, but I'm gonna try to stray away from weighing in on medical decisions that people want to make. So, all right. How would I shadow orthopedic surgeons? I've tried reaching out, but don't get any response. I don't have many connections either, and I believe it'd be beneficial to me, like it helped you. So you're right. I think that shadowing would be very beneficial to lots of people. It's tough. It's very hard. I think on social media, you got to be careful thinking like you're gonna be able to just like reach out to any surgeon out there and they're gonna be like, oh yeah, come hang out with me in the OR. Even for me, I had to really follow a pretty restricted path in my own medical school. I had to like email doctors within my medical school, and they allowed me in because I was a medical student there. I had all the necessary malpractice, all the paperwork. It's not easy getting someone into the OR because there's a lot of regulatory restrictions, and it makes sense, right? If you're having your surgery, you wouldn't want some random person, jumping into the OR, who knows what their background is, right? So I think my advice would be you have to stick with whatever institution you're part of. You can reach out to as many surgeons you can maybe network with, but I get lots of requests all the time and I have to turn a lot of people down, pretty much everyone, because unless you're affiliated in my hospital or medical school I work with, there's really no way I can get you into the hospital, get you into the operating room. That's the truth. So you have to kind of work through your institution is the best answer. Right. Sophia Guzman says, can you do like a short story time of your first solo surgery? Yeah, I could. My first solo surgery, I don't know if it was residency. I think about residency, and there was definitely times I did surgery on my own with the attending, like watching really closely, like if you watch Grey's Anatomy, like the attendings are like watching the resident, like it happened a lot, and I still remember that. You're always scared that you're going to do something wrong, and that's why you have the attendings watching you. That's why. So, all right, let's see. That was a good story. Maybe I'll have to remember that one day, and I'll make a video about it and whatnot. And I do want to ask you guys, while you're here, I think that I appreciate every single one of you guys for being here. Thank you so much. I wonder if I can I get a list of who's here? Is there any way to do that on this stream? No. All I can see is that there's 22 people, but I can't see everyone's who's here, unfortunately. So if you want to shout out, just, say hi and I'll shout you out. How about that? But other thing is that I wanted to ask you guys if you had any special requests for videos you really would want to see from me. I know that some of you guys watch other doctors here, like Dr. Mike, maybe Mama Dr. Jones, or Dr. Hope, or Christina Braley. These are Kevin Jubal. These are the YouTubers that I know that I've seen on here. There's not a lot of doctor YouTubers, from what I notice. I think doctors are all generally too busy to be on here. But if you guys have any special video types that you really want to see on here and you don't see anyone else making, please let me know. I will definitely experiment with them. And it seems to me that you guys really love these reaction videos to medical trauma. So I'm going to keep making those for sure. But I also have other videos I wanted to make personally, like, giving you guys advice on how to do well in medical school, pre-med, residency. I don't know if those are the videos you guys really want. So let me know, and I have my ears open and I'm ready to, make videos for you guys. Why did I choose ortho? I did just discuss that a little bit ago, which is, when I was a second year medical student, I saw knee surgery and I saw a knee fillet open before me, and it was an awesome experience just seeing all that anatomy. So, hello, Dr. Dan. I want to ask you, which is the most common surgery you perform in orthopedics? So, general orthopedics, which is like all extremities, shoulders, knees, arms, I would say that general orthopedics, when they take call, they see hip fractures the most. Hip fractures are like super common, right? A lot of older patients, they'll slip and they'll fall in their hip and break their hip, and it's a pretty serious injury. It needs surgery, and that's pretty common. We did a lot of that in residency. As a spine surgeon, I don't do much of that anymore. I focus primarily on neck and back injuries, and the most common surgery I do for spine surgery is something we call an ACDF, or cervical fusion, which is an anterior-cervical discectomy and fusion, which you make a small incision in your neck, go down to the spine, take the disc out, decompress the nerves, and you put a little implants, plate and screws. I talk to you guys all day about that. And in the back, we also, the most common surgery we do there is something called a discectomy or a microdiscectomy, where I go in and I actually remove a herniated disc that's pinching the nerve. I have a video on that if you want to watch that. It's pretty fun. So that's the most common spine surgery I do. What are some differences between spine neurosurgery and orthopedic spine surgery practice? Interesting question and good question. So there's not much of a difference, to be honest. I work with neurosurgeons all the time. We do co-surgery, and we actually do the same surgery. We're doing ACDFs, we're doing microdiscs, we're doing lumbar fusions. I actually did a combined neurosurgery and orthopedic fellowship. So half of my attendings in fellowship were actually neurosurgeons, and half of them were orthopedic surgeons. And so we all are doing the same surgery. So there's not a significant difference, in my opinion. Can you open up shop on your own right after residency, or do you suggest joining a private group instead of starting your own practice? So I joined a group. I think these days, I talk a lot about this on Twitter, which is like advocacy stuff about whether private practice or independent practice is still feasible in America. It's very tough to have a private practice in America, just because there's so many regulations with the field of medicine and trying to make sure that your practice keeps up with all the paperwork and fighting insurance companies. So honestly, it's tough to just open up shop on your own. You can try, and I know people who do it and they do it fine, but my recommendation would be joining a group, because you have support and you can pool your resources that way. And it's still possible to do independent practice by joining a group, but starting your own practice can be tough, I think, in my opinion, these days. How much patience does it take to endure all those years to finally be called attending orthopedic spine surgeon? How did you cope day in and day out, knowing that the goal is so far-fetched? That's a really good question. And Tevin, I gotta tell you, you're probably just repeated the thoughts in my mind of like every single day when I was in residency. I was like, oh my gosh, when is this going to end? It's taking forever. It's 5 years long. And I remember just feeling, pretty beaten down, like, oh, this is a very, very long tunnel of light. I don't even see it. So I think that, when you get in those situations where it just seems like the road is so long ahead of you, Gary Vee talks about this a lot, and I watch his stuff, and he talks a lot about the journey, right? Like enjoying the journey. It's sometimes really hard to just enjoy the journey when it's really tough. But I think when I think back, there were so many moments in this journey that were like so cool, right? Like the first time you are in an anatomy lab and you're cracking open the chest and you're looking at the heart, even though it's anatomy, or the first time, you interview your first patient ever in medical school where, it's a real patient and they're talking to you about their issues. I still remember that. And there's so many like cool experiences. Like every year of the medical journey is packed with things. Even residency, even though it's 5 years long, every year was full of like crazy stuff that happened, or crazy experiences, or just like big landmarks or milestones. Like you're doing your first case for this, first case for that. So the journey was like incredible. And there's nothing like it, honestly. Like if you have a career in accounting, like you're gonna learn how to do one thing, and then you're gonna like do it every single day, the rest of your life. And I don't know how much it changes. It could change a lot, but I don't think being a doctor is ever the same, like every single day, right? Even in my practice, like every single patient, there's still nuances you got to think about. Every case is a little different. There's twists to everything. But the whole journey was a pretty incredible journey. It was a tough journey, but it was memorable and amazing in different ways. So that's how I dealt with it. All right. Wow, lots of questions here. Sorry. I've been like, I'm falling behind. Oh my gosh. All right. Did you have any doubts about becoming a surgeon and why? Yes, I did. I remember in my 4th year when I was on these rotations where you kind of interview your auditioning, I was at a certain hospital and I was like sick. I got a really bad cold, and I was working like 14-hour days, or like longer than that. I think I was in the hospital like 19 hours a day, something ridiculous. And I was so tired, and I was sick, and I was like not really getting a lot of attention from the attendings. Like I was getting ignored. And I thought, like, this is like terrible. I would not want to do this for 5 years. And so that was the doubt. I almost quit during that away rotation. I almost did. I remember calling my family and being like, I think I'm going to just switch specialties. I think I'm going to do emergency medicine or something like that. And I remember one of my good friends just said, or my family member said, just stick it through the rest of this rotation, see how you like it, and then decide and make a decision. So stick it through to the end and then figure it out. And that was the best advice I could have gotten, honestly. I'm trying to think who gave me that advice. I have to think back, because I should thank that person, because I stayed on for the rest of that rotation. I met my mentor, lifelong mentor, and I ended up becoming like convinced I wanted to be an orthopedic surgeon because I stayed on that rotation. So, all right, how was your residency experience? Were attendings more encouraging or tough? They were pretty tough. It was a pretty intense experience for 5 years. Like some of the stuff you see on Grey's Anatomy, like people yelling at the residents, like that stuff happened in residency. And I would call it like tough love, and I think I described that in some of my reaction videos, because they don't want you to become like a bad surgeon. So if you make a mistake, you get yelled at. Well, fear is a powerful motivator. You don't want to get yelled at again, so you're not going to make that mistake again. So it was tough, I have to say. What is the worst injury you've ever seen? I've seen patients roll into trauma bay when I was a resident, dead already. I remember a patient came in once, and they couldn't figure out why he was like unconscious, I guess. And they were trying to like code him. And I wasn't like involved in the code. I just remember like I was an ortho resident, so I wasn't involved. But I remember hearing from another resident that the patient had a bullet hole in the back of his ear that no one spotted, like EMS had not seen. They just try to rush him to the hospital as fast as possible. But when they did the secondary survey and they were like looking at all his injuries and all his body parts, they saw a bullet hole in the back of his head, which is crazy. I've seen bullets like ended up in someone's spinal canal. I've seen that. I took out a bullet. I remember in someone's like forearm once. I was showing, you don't really have to do that, but it was like poking through the skin. So I thought that, one of the dangers is that it can migrate out and cause a wound later, or it can migrate deeper into the arm and cause a nerve injury or a vascular injury. So I just like took it out for him. I injected some lidocaine right where the bullet was, and made a little incision, and out it popped. And I was like, wow, I just took out a bullet from someone, just like the movies. So that's not that crazy, I guess, but these are some of the, I guess, most memorable things that I remember from residency. I'm really interested in cool ortho procedures. Talk about your time in residency, just some video examples. Okay, these are good video suggestions. Thank you. I'm gonna write some of these down. Was the hardest part of being, so I guess like a story time in residency, some of these stories I'm talking about, maybe I'll do that one of these days for a video. What is the hardest part of being pre-med in college and the hardest part of medical school? I would say the hardest part of being pre-med in college, I think, is convincing. I don't know. I think, I hate answering too many questions on being pre-med because I wasn't a real pre-med. I had gotten into that 7-year program. So I was already guaranteed into medical school. So I didn't have to worry about getting into medical school. But I still had to maintain a certain GPA, and I remember just staying motivated and making sure I kept up with my classes and whatnot. That was maybe the most difficult part of being pre-med. Hardest part of med school is like everyone around you is so smart because they're the smartest in their college classes. So studying really, really hard and getting average on my tests was like really hard to swallow. That never happened before, but that was the hardest part of medical school. How long was the longest ortho procedure you were part of? I can tell you that I remember in residency that I was on like a call that lasted 30 hours straight. I was in the operating room like 30 hours straight, like case after case after case kept rolling into the trauma bay. Then it was like the next patient came up, and then the next OR was getting ready, and then I would jump into that case, and it kept going. I remember, I think I got to scrub out a couple of times to eat and drink some water, and then come back in because they needed help in the OR. So, all right. So Eugene Ryu is asking how qualified a doctor has to be. I skipped the question here. Did you ever have a patient who was extremely rude? Yes, that's definitely happened. It's part of being a doctor. It comes with the territory, and you have to kind of figure out how to de-escalate the situation. You always have to kind of, stay on the high road, make sure that you understand the patients are usually responding like that because they're under a lot of stress, right? And it actually brings me back a lot of these Grey's Anatomy episodes. There's all these rude patients, and you see how like Derek Shepard responds to that. I remember doing a little segment on that. So yeah, I have had that, but you just have to deal with it appropriately. How qualified would a doctor who has general surgery be in comparison to an ortho specialty? For instance, do generals know as much as orthos in regards to procedures? So it's really not necessarily like who's a better surgeon or like who has more skills. It's more focused on, what body part, right? So general surgeons do abdominal work and some extremity work. If you're vascular, even within general surgery, there's a lot of different specialties that branch off. So general surgeons become like vascular surgeons, or they become endocrine surgeons, or they become a breast surgeon, or maybe, and they focus only on operating on certain parts. And some general surgeons do like general, so they do lots of different things, but even general surgeons are mainly focused on abdominal and chest surgeries, for what I know. They're not going to operate on extremities. So extremities like hand, forearms, knees, shoulders, they're all being done by ortho, and an ortho is not going to be working in the abdomen, right? So it's all about the body part. How do you preview, Helen's asking, how do you preview your lessons as a pre-med, since the textbook is super long and daunting? Right now, I'm still a high school graduate, can't find lectures, only TB, what should I do? Like biology is really beating me down. I get it. I can teach people, but tests kill me. Any suggestions? I think that, I would, when you get, I think that it's all about figuring out where you can find good practice questions. And I keep talking about this, but there's lots of different ways. You go to textbook, and sometimes the textbook have like supplemental, practice questions. Like sometimes some of the textbooks I remember would have these other booklets that had just test questions, practice questions, and you go through that. The other thing would be going to office hours with your TA or the professor and actually going through some of those practice questions with them. And then they may come up with some other questions or practice situations for you to go through. So I think it's all about focusing on how do I get quality practice questions, get my hands on them, and how do I find time to do them over and over and over. So that's gonna be my advice for all the pre-med test taking. Yeah, see, Hayden King is saying, one suggestion, look at practice questions and QBanks online. There are lots of mock test questions out there. Exactly, 100%. All about the questions, all about the practice questions. If you just focus on that, honestly, I think a lot of you guys would could do better on your exams. I think I'm going to do a video on this. I think there's a lot of questions on this. I'm a professional test taker. That's all I can say, even from high school. I took a lot of AP classes. I did really well on my SATs. So I started off really early getting really good at tests. And that was an advantage of mine when I went to pre-med and medical school. So if you can get good at preparing for exams, that's going to be a strong point for you. All right, videos on pre-med advice for aspiring orthopedic surgeons would be great. A cool idea would be a mock surgery with tools you use on an anatomical dummy, walking through steps of common surgery. That's a good idea, Allison. Thank you. You guys, I do have one video that you shouldn't miss out on. I have a video on my 14-year journey to becoming an orthopedic surgeon. It's in my videos. If you want to watch that, there's a lot of tips on my journey here. And if you guys haven't done this yet, make sure you smash that like button, right? I'm going to ask you to do that. Smash that like button on this live, so all your other pre-med and medical school friends may be able to see this video. I kind of felt awkward asking people to smash that like button when I used to start off doing my videos, and now I have no problem like saying, because I've practiced it, right? That's the theme of this video: practice, practice, practice. All right. Do you work more or less hours as attending? I would say I work less, compared to training. I mean, training was insane. You work all the time, just like you see in the Grey's Anatomy videos. So as an attending, my hours are much more controlled. So, have you ever heard of a spine surgeon named Kingsley Chin, Dr. Kingsley Chin from Jamaica, who attended Harvard Medical School? And that name sounds familiar. I think I've seen him on social media. And what is so I have heard of his name. Am I correct? Yeah, I think I've seen him on Instagram. But yeah, I don't know him personally. What is the most fulfilling aspect of being a spine surgeon in your own words? I would say the most fulfilling thing is literally I have patients who, when I meet them and I examine them, they're paralyzed or semi-paralyzed, hemiplegic. They can't move their arm or legs, and then I intervene with my hands, do an operation, and I take the pressure off their spinal cord into their nerves, and boom, they're walking again. So I was able to make a patient walk again. So that's an incredible feeling, and that'll never get old. So I love that aspect of being a spine surgeon, and it's very fulfilling. I have heard that once you become a doctor, you need to study forever. Where do you get info about new techniques, methods, et cetera, that came into practice after your med school? Good question. You do have to keep up with the latest techniques and the latest research. There's always new data and research being published by your peers. And you do that through reading journals, and you do that through attending courses and meetings. For the orthopedic surgeons, there's always an annual meeting that I go to, and there's all these courses there that kind of teach you about the latest data and latest studies on certain treatments or surgeries. And I also go to courses where you actually practice on cadavers to learn new techniques as well. All right. Sam Gulbenach says, hello from Toronto. Hello, hello. Shout outs to Sam. Thanks for being here on this live chat today. Sophia Guzman says, what is your dream surgery? I guess like what was my favorite surgery. I think that like a lot of different spine surgeries I do are like my dream surgeries. I love every single one of them. So, you know, is there a favorite I have out of that? I like the cervical surgery I talked about earlier, ACDF. That's one of my favorite surgeries because patients also do very, very well after that operation. You know, that people do well with all operations, but that one, especially, people just kind of, the patients do very, 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 very well. What's going on, Ratchan? Thanks for being here. Welcome to the live chat. Shout outs to you. Everyone let me know where you guys are live streaming from. You know, I'd like to know what country you're from, what city you're from. Please let me know. Shayna Newberger asked, how do you pay for MCAT prep and applications? I don't have cash for it, don't qualify for aid, and family can't help much. So that's a tough situation. I'm sorry that you feel that type of financial pressure. You know, I didn't come from a family with lots and lots of money. I do, you know, for the most part, I always felt like financial pressure, just like you, my whole career, honestly. And only recently am I feeling as an attending, you know, things are different from my whole path, even in high school and all this stuff. I always looked around and compared myself to my classmates. I didn't feel like I was financially as well off as them. So I think that, you know, I can't give great advice on this because everyone's situation is a little different, right? But I do know that I tried to work every chance I had, you know, any free summer I had, I was always working. And I did take on a lot of student debt to pay for my medical school and even college and whatnot. So sometimes you need to do that. You have to put in that investment to end up, you know, to get the training that you need. You know, you're in a place where you're pre-med and you try to take your MCATs. That's tough. You know, I think that, you know, sometimes I'm not encouraging this, but sometimes the only option you might have is, you know, taking loans out and whatnot. So, you know, everyone has to be a little creative. Sometimes take a year off, you know, save up money, work. So I don't have the best advice for that, but, you know, where there's a will, there's a way, and, you know, I'm sure you'll be able to figure it out. Kayla Walker, as an orthopedic surgeon, do you deal with patients' deaths very often? I don't, Kayla. You know, I was talking about this earlier. Orthopedic surgeons usually operate on patients who are pretty healthy. So you know, if a patient is near death, you shouldn't be doing orthopedic surgery on them for the most part, unless they have like a fracture or emergency. But I don't really deal with death very often. What's up, guys? What's going on? We've got someone from Andre from Mexico. How you doing? Welcome to live chat. Wadwad, hello from India. Welcome to live chat. Thank you for being here. All right. I know you guys have a lot of questions rolling in. I appreciate it. Allison is from New Jersey. What's up, New Jersey? That's where I did my residency. Do you have any programs that are close to me to help me my journey? I don't know any for high school students. I don't know if you're in high school or, you know, how old you are, but, you know, I do think that, you know, online, there's a lot of resources. I can tell you that much. You know, that's the great beauty of YouTube and allowing me to do even this live chat for you guys. There's like Kevin Ball, who does a lot of stuff for pre-meds and whatnot. So I do think, though, that I am going to wrap this up in a couple minutes because it's approaching. We are approaching midnight here in East Coast. So I'm probably going to wrap this up shortly. Get to bed. But thank you so much for joining me today on this live stream. I'll keep this up if you missed any part of this. You can always rewind, go back to it. I think we covered a lot of ground today. I am going to do a video in the future about, you know, how to ace every exam that you take. I'm trying to think about like the title for it. YouTube's so crazy because it's like you got to think about the title more than the content sometimes, because, you know, not enough people will click on it if you have like a boring title. So then you have to ask yourself, do I want to be clickbaity about this? But you know, whatever. Anyway, thank you so much, guys, for being here. Make sure you like this video, smash that like button, And I also have another video up on how to become an orthopedic spine surgeon, if that's what you were interested in being and why you came. You can follow me on Instagram at SpineDocNY, where I post stories here and there. Sometimes I'll post like my day in a life of a spine surgeon. I'll post like stuff from my office. I haven't been doing it lately, but I do it a lot in the past. You can also follow me on Twitter, where I talk a lot about more policy issues and like my activities in the American Medical Association, and trying to advocate in Washington, D.C. For patients and physicians. So you can follow me on those other channels. I'm also on TikTok. If you guys have TikTok, but I stopped posting there during the pandemic because I felt weird posting TikToks when like so many people are dying, and it was just a sad time. I may get on there soon. I love TikTok. Whenever I open it, it's like crazy videos. But you can find me on TikTok, Dr. Dan Choi, DrDanChoi. So I'm on all the platforms. I really love YouTube. I love you guys. And I'm going to keep making lots and lots of videos, hopefully, and keep those reaction videos going. I read every one of your comments, so thank you so much for being here. And I'll see you guys on the next video.